Welcome back, everyone. Now, customize your care with a treatment program specific to your needs.
Joining us now in this sponsored interview is Dr. Ray Andrew with Prestige Wellness Institute. Welcome to the show.
Thank you.
Glad you are here. Let's start with this. What kind of problems do you treat?
People come to Prestige Wellness Institute with a wide variety of problems. A lot of fatigue, anxiety, depression, very common problems today, autoimmune diseases, complications from medical procedures, cancer, all kinds of problems. But we don't focus on the problems. We found that when we focus on the people who have the problems, we get much better results. Because everyone, if we just focus on the problem, like let's say for depression, for example, we would just give you an antidepressant and cover up the problem. We wouldn't be addressing what's actually causing it.
Okay, so what kinds of patients are you seeing? Who are they?
So we see basically three types of patients. The first, they come in because they've heard we have a certain kind of service or we treat a certain kind of problem, and they say, I want this. And sometimes that's what they actually need, and sometimes it isn't. Sometimes they actually need something else, and we help them find what they need to solve the problem. Second type of patient we see is someone who's on his or her last leg. They come in saying, you're my last hope. They've seen half a dozen other doctors, including specialists and sometimes other functional medicine doctors, and they just have not gotten the answers or the results that they're looking for.
So what sets you apart then? What makes you different? How do you help them find those answers and results?
Well, we have we follow 6 pillars of treatment. The first is comprehensive. You know, we've been doing hormone pellet therapy for 3 decades now, and although we've done tens of thousands of them, we're not a pellet mill. Pellets are just one tiny bit of what we do. We look at the big picture, so we address gut and brain and hormones and infections and every part of the body, so it's comprehensive. It's also customized so that even though on paper you may have the same problems as somebody else, you're not going to get the same treatment because what's causing your problems is not exactly the same as what causes somebody else's problems.
Well, it's not one size fits all, and also it's cost effective.
Yes. You know, in healthcare, we tend to want a Rolls Royce for Kmart special prices. But unfortunately, that's not how it works. But when we invest in our health early, then we prevent the osteoporosis, the cancer, the heart disease, the diabetes, the Alzheimer's down the road, and those are a lot more expensive than preventing them.
Yeah, no better investment, right, than an investment in your health.
Yes.
You also say you're collaborative.
Yes. A lot of people, when they go to the doctor kind of has the air of, you know, I'm the doctor, you're the patient. Remember that, you do what I tell you to. I'm not your boss, I'm not your policeman. I'm your guide. And so we work together, and I give you the information, the tools, and the guidance you need, and you decide what to do with them. If you don't want to do them, that's fine, because you're the boss of your body. I don't have to live in it, you do.
Doctor, I love your bedside manner, and I can tell you also that other pillar is compassionate.
Yes. A lot of people who come to us have lost all hope because they've been told there's nothing wrong with you, when they know clearly there's a lot wrong with them, or they've been told there's nothing more we can do for you. And so we find one of our most powerful weapons, if we want to call it that, is love and understanding and hope. And when people come in and find that they are finally understood, that somebody gets them, then they feel, I've found where I can get healing.
I did not think you were going to say love. Love at the doctor's office. That's amazing. And finally, that last pillar is committed. You are committed to helping each of your patients.
Yes. When you walk out the door, we don't say, good luck, we'll see you later. We follow up with you after a procedure or between visits. We want to know how you're doing. Do you have any questions? Are you making the progress that we expect? Because we don't want you to come back 3 months later and say, well, you know, I'm not any better. We want to make sure you're moving forward.
I love it. Looking at the whole patient. I want you to be my doctor. I'm
right?
convinced. Yeah.
You're sold.
I am sold.